Hello, everyone. My name is Dr. Ali Tabari, and I want to present a pretty interesting case. This is a gentleman who presented to our office for something totally not associated with this condition, but he noted that some 20 years ago or something, he had some parotid surgery, and a little bit after that, every time he eats and chews something, he starts sweating on his cheek on the left side. So we are going to present this case. It's a rare case, but very interesting, and it goes through a lot of pretty important physiology. A lot of the physiology that is involved in this is pharmacological physiology. Pharmacists, a lot of their learning is based on this aspect of physiology. Pharmacists are really smart. And when I did my residency, the ER pharmacist at my hospital, he was the smartest guy. He was the go-to guy. Every doctor would go to him to ask questions about medicine. At any rate, let me show you what's going on. This is the gentleman, and as you can see, I'll explain what's going on a little bit more. But I gave him something to chew, a lemon sour candy, and as he's chewing, you can see that he's sweating on the left cheek, right before his ear, and he's not only sweating, it's flushing, it's feeling hot. It's disturbing him, and it has disturbed him for well over 20 years, and he really does not like it. So this is a condition called Frey syndrome. Like Glenn Frey, the late great singer. Remember Heat Is On, Beverly Hills Cop movie. Anyhow, the heat is on with this condition in the cheek where the surgery happened many years before. And let me explain a little bit of the physiology and what's going on. First off, you got to get deep into the nervous system physiology, and what we're talking about here is the peripheral nervous system. And there are two divisions of that. There's the somatic nervous system and the autonomic nervous system. Making it very simple and summarizing a lot, so not much detail on this, just presenting something so we could easily see what's going on. Now, somatic nervous system, these are things you could control. I raise my arm, that's somatic, I'm controlling that. Autonomic nervous system, these are things that are out of our control. Digestion of food, heart rate, things like that, things that we don't think about. Constriction or dilation of your pupil. So these are the two systems. Now let's start with the somatic peripheral system. You have this is the spinal, this is the central nervous system, this is the brain, this is the spinal cord. So you have a nerve coming out of the spinal cord, and it goes straight to the muscle, and it releases the famous neurotransmitter acetylcholine. And the acetylcholine attaches to a nicotinic receptor, and that makes the muscle contract. Okay, so this is the somatic, this is under our control. I raise my arm, that's what happens. Then you have the autonomic nervous system. Out of our control, your body's doing this for you. And then you have two divisions of the autonomic nervous system. You have the parasympathetic division and you have the sympathetic division. Okay, let's start with the parasympathetic nervous system. Okay, so here, the parasympathetic nervous system is kind of your system that controls digestion, bowel movements, things that you don't need really for emergencies, things that, your body's functioning, it needs to work, but it's not like a flight or fight situation. So these nerves generally come out of your these come out of your cranial base, and also your pelvic splanchnic nerve has fibers to this system. And in your cranial system, the cranial nerves, the mnemonic is 1973. It features your cranial nerves 3, 7, 9, and 10. Those carry the preganglionic fibers of your parasympathetic nervous system. Now with this system, your preganglionic fibers are long, and then they go and attach to another nerve fiber. So there's two nerve fibers, which is different than the somatic nervous system, which is one long nerve fiber going to the muscle. Here you have two nerve fibers. So you have a long preganglionic nerve fiber that releases again acetylcholine, and it attaches to the cell body of the second nerve system via a nicotinic receptor, same thing as the somatic so far. Then the signal travels down the postganglionic nerve fiber, releases acetylcholine again, and then affects the organ by the acetylcholine attaching to a muscarinic receptor. For instance, your parotid gland. Okay, it releases acetylcholine. The parotid gland has muscarinic receptors, and they release saliva. Okay, that's the parasympathetic branch of the autonomic nervous system. Now, there's the other branch of the autonomic nervous system, and that's the sympathetic. This is the fight or flight. I'm not going to get too involved in this, but we all know this from back in school. A bear is chasing you down. What do you need to happen? Your heart rate goes up, your pupils dilate to not let so much light in, your breathing increases, you need to move, and you need to fight, So the system here, these nerves are carried from the thoracic and lumbar levels of the spinal cord, okay? Now, the difference between this and this is that once they come out of your spinal cord, they have a short preganglionic neuron, okay? And that releases the same thing, acetylcholine. Releases that to the second order nerve, and the acetylcholine attaches to a nicotinic receptor. The signal goes down, and then you target the organ. For instance, your heart, make your heart beat faster. Okay? Now, there's a difference right now. The neurotransmitter that the postganglionic neuron releases is no longer acetylcholine. It's neuroepinephrine. Okay? And the receptor of the organ where the neuroepinephrine attaches to is the adrenal receptor, not the muscarinic or the nicotinic receptor. So this is the difference between the sympathetic aspect of the autonomic nervous system versus the parasympathetic aspect of the autonomic nervous system versus the somatic nervous system. A lot of things to go through, but this is like basic pharmacological physiology right here. Okay, now let's dive a little deeper into what's going on with this gentleman, both anatomically and physiologically. Okay, now we go in to the area in your brain that controls salivation. Okay, and there's a part of your brain, I just made a very, pretty much stick figure diagram. There's an area of your brain called the pontine tegmentum. Okay, and it has the inferior salivatory nucleus. Salivatory, that's all you got to remember. It controls salivation. Okay, so we're discussing this part, the parasympathetic aspect of what makes your saliva be secreted. Through the pontine tegmentum in the brain, there's an inferior salivatory nucleus. That has a nerve that comes out called the glossopharyngeal nerve. It's part of the cranial nerve number 9. Okay? It synapses with the otic ganglion. Okay? Near your tympanic membrane. Okay? There, it's going to obviously release acetylcholine. It's going to attach to a nicotinic receptor in the postganglionic nerve, which is the auriculotemporal nerve. It's a part of cranial nerve 5. The auriculotemporal nerve goes to your parotid, again releases acetylcholine, and your parotid secretes saliva when you want to eat, when you need saliva when you're chewing. Okay? The parotid also has sympathetic nerves going to it. Okay? It's an organ that also has sympathetic nerves, maybe to increase blood flow to the area. It doesn't make it secrete because that's parasympathetic function. Okay, so keep that in mind. Now, what happens surgically? Us humans do things. We do things to the body. Sometimes it's needed. Sometimes it's for whatever reason. We're not going to discuss that now. But what happens for some reason you have to take the parotid out? If you have a benign tumor, most likely a pleomorphic adenoma. When that gets taken out, some of the time, aberrantly, the auriculotemporal nerve gets taken out. Part of it gets taken out too. So you have this situation where you have part of the branch of the auriculotemporal nerve gets cut with the parotid part being removed. Okay? That's what happens sometimes in these surgeries. Okay? And then what happens 2 or 3 months later? Well, what happens is the sympathetic branch that was going to the parotid, you have this situation here. Okay, now this system is true for the most part, but there is one exception to this rule, and that's your sweat glands. Okay? So your sweat glands are part of your sympathetic nervous system. Okay? That's cognitive. Okay? So what happens is, however, that it's part of your sympathetic nervous system. However, the receptors of your sweat glands are actually muscarinic receptors, and the neurotransmitter is not norepinephrine. It's acetylcholine that induces your sweat glands to release sweat. Okay? So what happens in this situation, remember, you got part of that nerve that's gone, that's a postganglionic parasympathetic nerve fiber. And what happens a couple months after surgery is some of these sympathetic branches that were going to the parotid, now they're kind of dancing. They're combining with some of the branches of the auriculotemporal, some of them that are remaining that didn't get cut away. They're kind of dancing, intermingling, and they create endings to the skin. Okay? Releasing it aberrantly here to the skin, and that's why it's attracting these sweat glands to sweat. So that's what happened, unfortunately, to this gentleman, is that he gets what's called gustatory sweating, meaning he sweats every time he eats, and it's become really uncomfortable. How do we treat it? Well, in the old days, they would do surgery, cut out part of the nerve that was coming out of the brain stem, or they would maybe do another surgery to put some kind of sheath or muscular flap there under the skin to alleviate the symptom. But now, this may be treated with Botox, because Botox, as you know, inhibits the acetylcholine release. So for this gentleman, I have administered some Botox. The results, we don't know yet. I'm going to give you full disclosure. I don't know if it's helped them or not because it's been too early, but I will keep you posted.